Now, polling suggests that 1 in 5 adults has seen examples of corridor care in the NHS, which is where hospitals are so overwhelmed that patients end up spilling out of proper wards. And for many, the way to avoid the possibility of being stuck in such a situation is to go private, if they can afford it. Nearly a quarter of the population, some 16.4 million people, are now covered by a form of health insurance. That's gone up by almost 3 million since before the pandemic. Now, it might be a good answer for individuals, but is it good for the whole health system? And does private healthcare strip the NHS of resources or help it out of a hole? Two very different views on that for you. David Furness is the Director of Policy at the Independent Healthcare Providers, and Dr John Lister at Coventry University, a long-term founding member of Keep Our NHS Public. Good morning, both.
Good morning.
Morning.
Well, David, let's start with you on that question. Does private healthcare help or hinder the NHS overall? I suspect I know what you will say, but is there any evidence, is there any sort of data which suggests one way or the other?
Well, look, we think that private healthcare has an important role in two ways. You know, the first is that private hospitals, private clinics and other organisations play an important role in the NHS. So about 1 in 5 NHS operations last year was actually carried out in a private hospital. And that equates to about 1.5 million people being removed from the NHS waiting list because of private healthcare providers working as part of the NHS. And they do that at NHS prices. They do that in line with NHS values. It's always free to patients, free at the point of use. So I think that's one important point. And then the important thing, of course, is that people, as they always have got a choice of using private care if that's something that they want to do. And we know that people are doing that for operations, they're doing it for tests, they're doing it for GP appointments. It's no secret that the biggest driver of that is because of delays in being able to access NHS treatment. But we certainly think that the private sector plays a complementary role to the NHS, as it always has ever since it was founded.
Some people do suggest, though, that it's the same staff in the NHS and in the private sector. And if you are essentially jumping the queue by paying to go private, you are using the same staff who then can't work in the NHS itself. Is there any truth in that?
It's certainly true that lots of doctors work in both the NHS and the private system. And again, that's been a long-standing sort of way of working. But it offers choice to those doctors as well. And I think it's important to say that it's not to say that if those doctors weren't working in the private system, they would definitely be doing more work in the NHS, which is obviously kind of resource constrained and in some places capacity constrained as well, because we know, for instance, the Royal College of Surgeons often points to the fact that its surgeons can't operate as much as they want to in the NHS because there aren't always the operating theatres available. So I think actually this is a really good way of using the healthcare staff that we've got. Two other quick points. One is that, you know, the majority of nurses that work in the private sector are employed by those organisations. They're not working in the NHS as well. So we are adding staff. And the independent sector is playing a more and more important role in training. You know, we know that we need to do more in that space. The biggest nurse apprenticeship scheme in England is one that comes that's run by one of the private hospital chains. More and more doctors are being trained in the independent sector as well. So we are also adding staff in that way too.
Dr Lister, how do you view the contribution of private healthcare? Because there are now, I mean, those stats speak for themselves, don't they? People are taking on health insurance. They are, in some cases, paying to go private, even if they don't have insurance because the waiting lists are so long. I mean, is it helpful to you overall, despite the fact that in some ways it might take away from what the NHS is trying to do?
Well, you began this item by talking about the corridor care and the numbers of patients queuing up for emergency treatment. And of course, the private sector doesn't do any of that at all. So that is an area where the expansion of the private sector doesn't help in any way whatsoever. In terms of people on waiting lists, people who find themselves on an NHS waiting list and think, well, maybe private insurance might be an option, will be rather brought down by the fact that they're excluded because they've already got a pre-existing condition, so they won't be able to get out of it that way. The self-pay numbers, the numbers of people who, without health insurance, make use of private hospitals, have not actually increased since 2021. They jumped up after the COVID pandemic eased by about 40% compared to 2019, and they've stayed flat ever since. So there's very little evidence that large numbers of people are actually resorting to private care to escape the actual problems on the NHS waiting list. And the point you raised about staffing is absolutely valid. I mean, if the private sector expands, the only way they can acquire more staff is by taking them out of their involvement in the NHS, and that will worsen the situation in the front line in the A&E departments.
So tell me how you view the private sector then, Dr. Lister. I mean, is it something the NHS is going to have to work alongside? Because some people have a very ideological take on this. You know, they just I never want private. I don't believe in private. I believe in waiting in the NHS. And it's a very valid point if you don't have a major health concern. But if you do, and you're waiting for a long time, and you do have health insurance, is it not a sensible idea for some people to use that route?
As long as you haven't got very much wrong with you and you've got private health insurance, I suppose it might be an option. But I mean, the problem with the private hospitals is they're very limited in what they can do. Very few of them have intensive care units and more intensive support, or can cope with complex conditions. Only the very largest of those can do that. The average size of a private hospital is 50 beds. And they are equipped only to deal with the most minor cases. So as long as there's not very much wrong with you and you're prepared to pay quite a lot of money for it, then you can access a private hospital. But for most people on NHS waiting lists, they've got either more than one thing wrong with them, or they've got other reasons why they're more complex than the private sector is going to be very keen to take. So even if the NHS is paying the bill, the private sector is not necessarily the answer to the problem. The most easy and straightforward answer for the government would be to expand the NHS, which does most of the care for most people anyway, and is crying out for the investment to actually enable it to expand the capacity that has been constrained.
David Furness, on that point, is the potential there for the independent sector, the private sector, to do more of that kind of intensive care, the hospital care that the NHS does at the moment, or is that something that the sector never wants to be involved in?
No, I think let me just respond to Dr. Lister's point, saying, you can only go private if there's not much wrong with you, kind of very minor. I just don't think that's true at all. And this idea that you can't be treated in a private hospital because they don't have, intensive care facilities. 50% of NHS hospitals where they're carrying out elective care don't have intensive care facilities because they're not needed for the vast majority of people who are having those kinds of treatments. So I think this is just a total myth. And I think, as I said, 1.5 million people left the waiting list last year because they were treated by private hospitals that would otherwise be there. We've got 7.5 million people on NHS waiting lists, so it seems bizarre to me to suggest that we wouldn't want to use all the capacity that's available across the system to help deal with that.
Dr. Lister?
Well, the reason the private sector is so keen to get the NHS to refer more patients is because they're not as busy as they might be, and the expansion they expected in self-pay patients hasn't happened, and the numbers accessing private health insurance for treatment is not very great either. So they haven't had the big bounce they expected. Bear in mind, the number of patients actually using self-pay has gone up to 282,000 a year at the last count. That's 282,000 people paying up front for care without insurance. But the number of waiting lists has gone up by comparison to 2019 by well over 3 million. So it's a tiny minority of people are finding that this is an answer to their problems. And I do say that actually all NHS hospitals, even if they don't have ITU units, do have a multidisciplinary team of staff there. The private hospitals don't have that. So people with more complex conditions can't afford the big hospitals that can deliver that more complex treatment. That's the limitation they have. They have 8,000 beds. If all of us decided on waiting lists, all of us decided tomorrow to go private, we wouldn't be able to. There is not enough capacity there to do it.
David Furness and Dr. John Lister, thank you both for joining us to talk about the sort of tension, I suppose, between NHS and private healthcare and how people can access it.